Diabetes has exploded 700% in the last 50 years, and it is estimated by 2030, which is right around the corner, is going to be half of all medical claims. Right now in America, every minute somebody has an amputation, and every 30 seconds someone's dying from complications. That doesn't have to happen if we get a better handle on how to manage it. As of now, 34.2 million people in America have diabetes. That's about 1 in every 10. And shockingly, 1 in every 5 have it and they don't even know that they have it. About 10% of blue-collar workers across the United States have diabetes. About 15 to 17% of the trucking industry has diabetes. And 20% of American Indians have diabetes. In the white-collar world, it's about 7 to 9% of the population. It's a chronic disease. If someone chooses not to manage their diabetes, it's going to manage them. You're going to have problems with your ears, with your eyes, with your nerves, with your heart. 80% of people who have diabetes also have hypertension, blood vessels, kidneys. It's a very, very, very serious disease. 34 million people in America have diabetes, okay? 5% have type 1. Type 2, 95% of those 30 million people have type 2 diabetes. Type 2 diabetes is a lifestyle disease. Your body doesn't break down the insulin and the sugar as well as it is with somebody who doesn't have it. I also thought I should mention prediabetes because there's a lot of buzz in the industry about what is prediabetes. So as you see on the screen, you can be at risk for prediabetes, which means your sugar levels are a little bit higher than normal. It should be around 100, so maybe they're 125 or higher. So who's at risk for prediabetes? As it says here, over 45, not active more than 3 days a week, family history of diabetes, high blood pressure, and if you're overweight, it greatly increases your risk of having diabetes. The odds are against you if you have diabetes. It's very hard to manage, but it is manageable. Probability is you will have problems with your eyes, you will have problems with glaucoma, with a heart attack, heart failure, high blood pressure. 80% of people who have diabetes also have issues with their blood pressure. These are some of the signs and symptoms if you have too much sugar or too little sugar, because sometimes it's helpful if you notice an employee or a family member or friend looking really pale or sweaty or sleepy, hungry, having to go to the bathroom a lot, blurred vision. This is also really important. 15 days a year, people who have diabetes have something called presenteeism. Their bodies are a little bit off. Maybe their vision's a little blurry, maybe their hands are a little bit shaky, maybe they feel a little bit unstable. Well, if you're an employer, look at your workers' comp claims, because about 70% of people who have diabetes also have workers' comp claims because their bodies are a little bit off sometimes. So what is the most effective way to manage diabetes for type 2 diabetes? Okay. Testing your sugar level, getting a coach. I always use the analogy, our program is like getting an angel on your shoulder to help you in the journey of life. We all need an angel because life's just challenging for all different kinds of diseases. Getting a coach, somebody to support you, checking your blood pressure regularly, coming up with a meal plan, and walking. So the combination of support, of education, of testing, of management from a perspective of kind of creating your meal plan for a week. Because remember, you cannot solve a lifestyle disease by popping pills. The only way you can solve a lifestyle disease is by what? Changing your lifestyle. If you change your lifestyle, you can put type 2 diabetes in remission. No one knows what causes it, but it is manageable.